So at this point, let's officially start Study Club. So I want to thank Larry Gazzardo, our head instructor here, joining us as always. I want to thank Tara LaCour. Did I say that right?
Yes.
Okay. She is one of our All-Star Dental Academy coaches. We also have Eric Vickery, one of our longstanding All-Star Dental Academy coaches. We have Tom lurking in the background on mute and taking notes for us. Okay. So we talk about verbiage for success, and there's a difference between verbiage and scripts. I'm sure a lot of you have been exposed to the concepts of scripts or sales training, and for those that know All-Star will hear what I'm saying as repetitive. Those who don't will be like, oh, really? All-Star, we're all about service-based approach. We're not about sales. And certainly sales from one aspect is important. You have to make money, but the word sales and the negative connotation that's associated with it in dentistry, because it's been going on for so long, is not something, it's kind of a very sour point for dental offices, for patients. And so what the difference is, we kind of, with sales, we're trying to get an end point, regardless of what you say or do. You just want to get more new patients. With service, you want to get patients and you want to do it ethically. You want them to be happy and excited. So one's manipulation, one's attraction. Scripts is kind of a very like quick way, in some shortcut way to get an approach, to get something done. And I know a lot of you go, oh, this, you might hear people say, I have this new script that's going to change your practice. And it never does. And the problems with scripts is they sound scripted, and that's one of the biggest things. The other problems with scripts is they're limited. So if you follow it and somebody asks you a question that's not related to the script, you don't know what to do. And plus, they also purport a perspective as only one way. And one of the things our head instructor always talks about, Larry, is you never want to throw what out the window?
You never want to throw logic out the window.
Right. And so sometimes we'll have our students say, well, I don't know if I agree with that, what you say. We say, fine, let's do something different. And that's what we mean by verbiage. In All-Star, we're always trying to give you different verbiage that will always fit a service-based approach. So we're not going to do something that's not aligned with that, but there's many ways that you can say it, and you could also adjust. So tonight, we are going to have a verbiage fest. We are going to explore some of the verbiage you want to hear. You know, Dana Russell, who will be joining us later, hopefully she may not, she got stuck on kind of between connecting flights, is our VP of coaching. And when I was at one of our on-sites, we got the idea that a lot of the team members and dentists wanted to know specific verbiage, and they love it. And so that's what we're doing tonight. So here's how we're gonna go. I love to hear from you, but what we're gonna start with is, let me just kind of cover some of the agenda we sent out earlier. So we are going to start with topics that are not directly addressed in All-Star. So we'll address phone issues and broken appointments and scheduling issue verbiage a little later if we have time. But what I like to start with first is I want to go through each of our coach and our head instructor, and I want you all to pick one situation in office that that you find is an issue and that you want to provide verbiage towards it. So I'll start with each one of you, and then every one of our listeners, I want you to start writing down, listening, but writing down some questions you have so that I can ask our team and we can get the verbiage. I'm also going to transcribe this study club so that the students can get copies of the replay and the transcript when we get it out back in about a week from now. Okay, so let's start with Eric. We'll start with Eric. Eric, give me a kind of an area that is near to your heart that and provide us some verbiage. Let's get some verbiage.
Yeah, so the biggest thing we all say in dentistry we hate is selling, the S word, sell. So understanding that that's what we do, we want to do it without the pressure. We have to understand that people buying for their reasons, not necessarily our reasons, that throws out the words, you need a crown. Need is not going to work at that point because that's just what we like to say. You need to clean your room. You need to take out the trash. And now they're going to automatically repel. And the second part is that people have to buy a problem before they're seeking a solution. And so the easiest step that we can do as professionals, chairside, is in layman's terms, describe to the patient what we're seeing that's a problem and talk about concerns. Conditions are concerns. So doctors would, hygienists, assistants would be saying, you know, I look at this area of your mouth. I'm concerned about this condition, decay, gum disease, simple terms, and this is why. Here's what it leads to, the consequences of that condition. Luckily in dentistry, we only have two consequences, right? Two consequences, toothache, tooth loss, maybe a third, cosmetics, but for the most part, if we know our patients, we know what their reasons are. Why are they sitting in a chair before we ever look in their mouth? We could connect those reasons to why we're concerned about what the problem is. So if Alex, the patient, I might say, Alex, I'm really concerned about what's going on the upper right here with these two teeth. As you can see on the picture, there's large fractures caused by these old metal fillings. The reason I'm concerned about those is because what's going to happen down the road if nothing is corrected, biting and chomping on these, Alex? As you continue to bite on these are, I'm in California, so we would say these are fault lines, right? and eventually these teeth are going to do what, Alex? What's going to happen to them? What do you think?
They're going to fall towards
the center of the earth. Yeah, they're going to fall in the Pacific Ocean.
You're going to cause your head to fall off, you know, your neck.
Right here. So now, here's where we tend to break the rule. They go, okay, yeah, it's going to break. And then we say, so you need 2 crowns. And we break the rule right there. And we get so excited, we move past an important part. The question we have to be asking ourselves is, does the patient, Alex, believe that there's a problem to be solved? Or did I simply just explain what's going on in his mouth? So I have to know, did you buy into the problem, Alex? So I have to ask a question before I pass go. So the question, you know, that we want to ask here is, did you buy the problem? How do we phrase that? You could say, I could say, Alex, how concerned are you with preventing these 2 teeth from breaking?
All right.
And if he says no, I'm not concerned about it, well, then let me talk to you about why you need 2 crowns there. That doesn't make sense, right? It wouldn't make sense for me to move into treatment.
You're breaking rapport. You're breaking rapport, which is a fundamental aspect of what we teach. Is you always want to be in rapport, and when you say I need, you know, it's about you or you need, break rapport. Yeah, good point.
Need is a 4-letter word, exactly. Yeah, need is a 4-letter word. Our goal is to avoid us telling the patient what they need. Instead, we're providing them with what they want. So you told me earlier you want to avoid pain. You want to save your teeth the rest of your life. I'm addressing that. What's important to you in my case presentation, the direction I go, I'm delivering it on that promise. We're going to help you achieve that. So if you say to me, yeah, I want to prevent that from happening, I now have permission to now talk treatment.
Right, getting permission.
And then at the end, I've got to then, once I talk about on-laser crowns or fillings, whatever it is, I then have to ask you, would you like to go ahead and get this scheduled?
Right.
If I'm not asking, I say, great, we'll have you go up front and see Tara. She'll get you all set. We'll see you next time. And there's this assumption, but they have no intent whatsoever of scheduling. And they blow right by.
So what I like to do before I move on to the next is I want Tara and then Larry to comment as to give me another, you can pass if you don't, but give me another verbiage. So we had the same situation, but I want to demonstrate there's different verbiage for the same situation. So any comments, Tara, on could we add or change the verbiage a little bit in your mind that you might use differently?
I think that, I mean, Eric is so spot on to a lot of the things that I suggest. You know, tell them what they need, give them what they want. You know, it's really just that simple. And it's a good reminder that in dentistry we don't just sell products. We sell solutions to problems. And if we can remember that when we're going into the
we provide solutions to problems.
We provide solutions to problems, and if hygiene is pre-assessing, if that assistant is pre-assessing, and I like to call it volley it up, doctor can go in there, and we're giving that treatment plan coordinator just a ball to just smash, because that patient's ready to go. And I like for my doctors to always say, I can get this done for you today if I can fit it into my schedule and leave the room. If you might not have time that day, but by their answer to that, if you've created enough urgency.
Gotcha. Larry?
And urgency.
Okay.
Well, I think what Eric said was just very, very simple, and I think it fits in with, our theory of not having something to memorize before you talk to a patient,
right,
because it makes things complicated. And what I don't like about scripting is that you're not thinking. You're paying more attention to what you're going to say next instead of what is the person saying to me. But what I would add to what Eric said is that we don't want to put any pressure on a patient, because we already know if a patient senses pressure, they're going to react negatively to anything that we promote or anything that we suggest. They're going to react negatively. So the mindset that we have to have is that, I'm here to help you be as healthy as you would like to be. And so because of that, when you told me you wanted to keep your teeth for the rest of your life, or, when you told me that you wanted to be able to keep your teeth clean, or, you wanted them to work the way that they were supposed to work, I looked for some very specific things that would tell me, you're not going to be able to keep your teeth, or you're not going to be able to keep them clean. That's why when I saw these 2 cracked teeth up here, I recognized something is wrong, and that's what I wanted to know how you wanted to feel about it. But the point I'm trying to make here is that we don't want people to feel pressure. We want you to be able to listen to patients and respond exactly to what they're telling us. We need to spend our time clarifying what we think we hear the patient saying to us, because the big trap that we fall into all the time is that we think patients know what to ask us. Even though we said we wouldn't get into all the phone skills and all that, it's one of the big things that gets us into trouble, particularly on the phone, but it happens face to face, is that we think people know what to ask us, and we forget they don't expect to know what to ask us, and they don't know what to ask us. That's why they ask so many kind of crazy questions all the time. So we want to listen to the patient, and then we want to make sure that we also verify with them to be sure that we heard them correctly. Now, what I like about that is number one, it removes all pressure. Let me see if I hear you correctly, because what I thought I heard you say was X. Did I get that right? And so not only does it remove the pressure, but you could be completely wrong in what you thought you heard from the patient. But when you give them the opportunity to clarify themselves, they're liking you better. Because emotionally, all of us enjoy the idea that, oh, you're listening to me. So I don't want to complicate what I heard Eric say, because I thought he was spot on, and it doesn't have to be more difficult than that. But the key here is we want to verify with whoever we're talking to, wherever we're talking to them, before we ever respond.
Yeah, it's like what Heather talks about in the phone program is that, with the price shopper on the phone, that they don't know what, they're asking for price because they don't know what else to say, so they're, part of it is to try to help them discover that. And that's what you guys are doing. You're coaching them through a process.
It is, because I can't be more attached to the outcome than the patient is.
Yes.
Because you know what I mean? Because I've been psychotically in love in my life. And what I have found is that when your wife loves you as much as you love her, that's good.
That's good.
But when you care about something more than how they care about you, then that person's going to sense pressure, and that never ends well. So that's why I say my mindset is I want to help you be as healthy as you would like to be. Now, I have a definition of what I think that looks like, and I'll certainly share that with you. But if you have a difference of opinion, I want to help you do what you want. Most people want to be as healthy as they possibly can be.
Great stuff. All right, so now we're going to go to Tara and then Larry, and we'll do the same commentary. Then we're going to go to, after that, rapid fire questions. And so I'll get a question, and then I will assign it to one of you based on what you said you want to cover, and then we'll just try to get as much verbiage as we can out of this. But as you can see and demonstrate, this process of verbiage is, you can't just do a script. There's so many layers to the onion here. We have to, and there's a process that we follow and consideration. And when you study this way, you are prepared to engage a person, genuinely. Okay, and they feel that. People, when you're scripting something, you didn't put the effort. They know when you're faking it. They know when you haven't tried. Try calling some of these utility companies and see how well trained they are, and how much they care. All right, Tara, your turn.